we call it PCRI, but we wanted to talk eventually about BPH. And to me, BPH is arguably the biggest prostate problem in the world.
Clearly.
It doesn't mean, not in terms of severity and life-threatening always, but can you tell people a little bit about BPH and why, and the kind of epidemic that it really is and why it doesn't get any attention?
Well, BPH is probably 10 times more common in terms of a clinical diagnosis than is prostate cancer. And it's also important to understand that prostate cancer patients almost all have BPH. BPH is a histological diagnosis first, meaning it's something we see under the microscope, but it manifests as men age with a variety of lower urinary tract symptoms, avoiding troubles, difficulties with the urination. And so many men with prostate cancer, will have these elements in their sort of their clinical presentation, but I think they think of themselves as cancer patients and maybe misunderstand that BPH is right along there too. And certainly of patients who don't have prostate cancer diagnoses, BPH is enormously prevalent. Probably 50% of men over age 50 have symptoms. Some symptoms are mild, some are nuisances, some are just horrifying.
Yeah.
And I think that the reason it hasn't gotten more press has a lot to do with how men approach their own healthcare. And men are relatively, they're certainly less proactive than say women are. It's statistically been shown.
Yeah.
So I think that we're partly responsible for our own bladder demise, if you will, because we're inactive in the evaluation and the treatment. We're also pretty afraid of treatment options, which is a lot of why the modalities that are coming along have blossomed.
Yeah, I'm actually really sad that we're scared to be diagnosed with BPH or be treated for BPH. And here's my theory. The reason why we shouldn't be sad is because BPH may be responsible for the greatest clouding of a prostate cancer diagnosis since the history of medicine, since time began. And what I mean by that is the number one reason for a rising PSA as we age is generally BPH. It's not prostate cancer, right?
And this is maybe one of the blessings of BPH, is it gets men in the door to get their PSA to eventually receive their therapy for prostate cancer. It wasn't the cancer causing the symptoms, because it typically doesn't. Prostate cancer doesn't make prostates big, but BPH does. Bigger prostates tend to be associated with more urinary symptoms.
So if I'm a guy in my 40s and then suddenly I find myself in my 50s and I wasn't getting up at all at night, and now I'm getting up 2 and 3 times a night, isn't that weird? Isn't that strange? But a lot of guys will say to me, essentially, well, I just get up 2 or 3 times a night. What's the big deal? And I'm going, well, maybe you don't have to get up that often.
Yeah.
Right?
I don't think that every man with urinary symptoms needs a fix. So we stratify those urinary symptoms by way of validated questionnaires. When a man comes in to see us, we want to know just how significant your symptoms are. And these questionnaires that we use, the IPSS or the AUA symptom index, they're very helpful at kind of gauging where a patient is. And not only where he is now, but how he progresses in 6 months or a year.
And they can do those online and bring them to you, right?
Easily, yeah.
So this AUA symptom score and IPSS, you can find them online and then take them to your office, fill them out.
Yeah, we start to take notice when the score is over 7. So 1 to 7 is considered a mild state of symptoms. The scores cap out at 35. So by the time someone's in their mid-20s to 30s, that's a guy who's really bothered. And by that time, ought to have some intervention. But a guy who's getting up for the first, it's just becoming an issue, gets up once or twice, maybe it's after he's had a little wine with dinner, some caffeine too late in the day, this might just be sort of a natural part of getting a little older, having a little less bladder compliance.
Right.
But as it progresses and there's more symptoms, and the list is long of the things that can manifest, that's when patients need to be seen. And honestly, these are the same guys that we would recommend being seen anyway. It's time for your PSA, your digital rectal exam. Let's get in and just do a little checkup.
Do you see BPH run in families? So when dad has it, Bobby and Billy have it? I mean, it seems like everything can be passed on genetically these days. Have you seen
I don't know
anything
how
like
you
that?
distinguish because manhood is associated with BPH, so it's just so common that while it is potentially hereditary, I think just having the XY situation going on, you're going to see some BPH. Almost every man under the microscope gets BPH, so we
Yeah.
talked about the histological nature of it, and so many of those guys actually have symptoms that I think it's a little hard to say, well, if dad had it, you're going to, probably you are going to get it,
Yeah.
but so is your neighbor down the street.